And so just to give you a little more of what that means, health departments across this country have responsibility for administering more than half of the Centers for Disease Control and Prevention's HIV prevention resources. And they administer more than a third of the federal resources that come from CDC to address viral hepatitis. Health departments, in particular state health departments, administer more than half of the Ryan White CARE program funding, including AIDS drug assistance programs. But that's not all, that's just the federal piece, and one of the things, the picture I want to paint today is what are the state and local resources that are also brought to bear. And this is where there are numbers, and so I'm going to have to look down. I think most of us don't recognize how much state and local governments really put into addressing these epidemics. And so when you look at prevention, and we have done that recently through a prevention inventory project with the Kaiser Family Foundation, we found that state and local governments contribute 35% of all the resources across this country that are available for HIV prevention. And we realized that when it comes to AIDS drug assistance programs, state governments contribute 21% of all the resources that are available for AIDS drug assistance programs. What's notable about AIDS drug assistance programs, and again, that's the Lifeline program that provides care and treatment for uninsured people and underinsured people across this country, is that the federal government's only responsible for about half of the funding that's made available. And it becomes a patchwork of resources that we have to pull together to make sure that these services continue. So, as part of today's National AIDS Awareness Day, it's really important to understand what's happening out there across the field. And I wanted to report the results of a survey. We've surveyed twice all the health departments across the country to see what's happening as a result of the economic downturn. And, you know, we don't wake up a day without hearing what's happening to state and local governments and to their budgets. So we've tried to assess very specifically what's happened to funding for HIV and viral hepatitis programs. And it's very disturbing and discouraging, the results that we've found. Our most recent survey results show that in state fiscal year 2009, 19 states alone reported a total loss of $161 million in state and local revenue for specific HIV, AIDS, and viral hepatitis programming, $160 million. And I think what is even more discouraging, particularly as we see Roberto's presentation and the number of growing populations that need prevention services, over 70% of those cuts came from prevention, came from our HIV prevention programs. Another 36% came from Ryan White services, in particular Part B. 50% came from AIDS drug assistance programs. And again, there were cuts in viral hepatitis, cuts in surveillance, and cuts in other program areas. Looking forward to fiscal year 2010 out across the country, the picture's not getting that much better. We already know that 13 states have lost an additional $12 million, and everyone's anticipating rolling in additional cuts. For some of us, I think what is even more troubling is what is happening to the public health workforce out there. We understand from our survey there are currently 153 open and unfilled positions inside HIV/AIDS programs in 22 states. 66 program positions have been eliminated in just 10 states. 19 states report hiring freezes. 12 states have mandatory staff furloughs. That means you don't go to work and you don't get paid from between 12 and 36 days a year. Additional staff capacity impacts include pay freezes, pay cuts up to 2.5%, travel freezes, promotion freezes. It's getting really difficult out there across the country for our public health workforce to continue to get the job done that we need, to say nothing of the scaling up of the work that we need to get done. I think the other thing that's really notable, and why I'm here talking about the public health system out there, is that many of the health departments across the country are trying very hard not to pass these cuts along to their community-based providers. And that's why we're seeing the public health workforce get hit so hard with furloughs and cuts and position freezes, because they don't want to pass on those cuts to their community-based providers. The last thing they want to do is trim services. But we know these cuts are getting so significant that inevitably there's going to be curtailment in the availability of services across the country. The other thing we know is that out of 26 states responding, a lot of them have their HIV/AIDS and viral hepatitis staff being pulled into H1N1 flu activities. That's just how stretched thin the public health system is across the country. So our colleagues at the National Association of City County Health Officials have documented even further the erosion of the public health system. We're focusing at the state level, at the public health departments. They went further and were looking at the local health departments, and they found that they've lost over 8,000 staff positions in local public health in the last year. And that was on top of 7,000 positions they lost in 2008. So, it's awful to come and give a presentation where you're the bearer of bad news. But I think it is an opportunity, particularly as we're debating health reform, for us to all stand up and talk about what's happening across this country. So I've got a few take-home messages for National Latino AIDS Awareness Day that I think we all need to have resonating through the halls of Congress over the next weeks and months. First, when you look at HIV and viral hepatitis fundings for Latino communities, you have to look beyond the federal funding. Clearly, we need that federal funding, but there's state and local resources to be brought to bear as well, and you've got to get the full picture. Second, we desperately need increases in federal funding, given what's happening out there across the state and local budgets. And we know that process for fiscal year 2010 is still underway, and there are still opportunities to have an impact and get the increases that we need for the entire HIV/AIDS portfolio, prevention, Ryan White, and you name it, the list goes on. Third, prevention funding continues to lag far behind care and treatment funding. When you look at all of the federal funding for HIV/AIDS in this country, only 4% of it goes to provide prevention services, only 4%. And again, when you couple my presentation with what you've seen about the census and the growing numbers of people in Latino communities who need prevention services, we've got to shift that balance and make sure that we have more resources for prevention in coming years. And finally, we really have to start paying attention to what's happening to the state and local public health workforce in this country. We desperately need health reform that is going to create a public health investment fund that will provide dedicated funding to shore up the public health system in this country. Now, the good news is there are provisions pending in both the House bill and the Senate bill that would do just that, would provide dedicated resources for a public health and wellness investment fund that would help us address these needs. I think it's critical that we hear more voices lining up in support of those provisions, because we know the negotiating is going to get tough, and those are provisions that we cannot afford to have chopped off and left at the end of the day. It needs to be in the final bill. So on that note, I really again want to thank you for inviting me to be here today. I hope the next time I'm here I'm going to bring better news, because I really do believe that if we all work together we can turn the situation around, but the time is now to act. Thank you.